Nancy, Second Harvest is no stranger to disaster relief. The organization has been providing frontline relief for the region's food needs for more than 40 years through natural disaster, through economic ups and downs, through changing communities. But this pandemic is different than anything else we've seen in our lifetimes. Tell us a little bit about that.
No, you're absolutely right. What we call it is the perfect storm. So we started with tornadoes. And quite honestly, when you think about a natural disaster, it's usually, hits specific areas, just like the tornado did. And we were boots on the ground immediately, making sure that we got food to the families and the children that needed it. But then when you layer on a pandemic, it really does become the perfect storm because now it's not just maybe a certain area. This pandemic is impacting every single household exponentially. Those that were already vulnerable are already in a worse situation now. And then you think about all the Americans that have been out there just having, working really, really hard to have a job and to earn a living and to take care of their families. Many people are out of jobs. Our unemployment obviously has skyrocketed, and people for the first time are in food lines needing to get food for their family.
Tell us a little bit more about Second Harvest. Everybody knows Second Harvest. Everybody knows that you are an essential community service in good times and in bad times. But in terms of your reach here in Middle Tennessee and around Tennessee, describe a little bit for our listeners how large you are, what your reach is, how many people you cover.
So we serve Middle and West Tennessee, 46 counties. So if you think of going as far west as Gibson County and as far east as Pickett County, there are about 350,000 food insecure families. And what we do every year, like last year, for example, we provided around 29 million meals to those families that are food insecure. And we do our work by working with 460 partner agencies in those communities. So let's just say you live in a certain area in a certain county and you need food. You usually need something else, like you may need financial support, housing, or whatever. But when people reach out to us for a food need, we connect them with one of our partners that is right there in their community for easy access to get the food that they need. So this is truthfully, we get the food, we make sure we sort it, we make sure there's food safety, and it's with our partners that we make sure that food gets right to the people that need it most.
And is Second Harvest in every community across the country?
Feeding America is the largest hunger relief organization in the United States. And there are 200 food banks, we're one of them, that cover every single county in the United States. And like I mentioned to you earlier, there are 5 food banks that cover Tennessee, and we are the largest food bank in Tennessee. But we do work collectively. And if you think across the whole state, there's over 1,559 partners that the 5 food banks collectively work with, and over 80 million meals that we're getting out to Tennesseans on an annual basis.
Across the country, since March, more than 36 million jobless claims have been filed here in America. And right here in Tennessee, it's been more than 500,000 people who filed these jobless claims. I was looking just the other day, and the Federal Reserve says that 39% of households with income below $40,000 had lost their jobs. Almost 40% have lost their jobs. And this obviously implies, in fact, underscores the fact that economic harm of this coronavirus will disproportionately hit those of lower income, those households of lower income. And this is going to extend, as you mentioned a few minutes ago, not just a few months. A natural disaster we recover from because it's an insult. We recover from it. We know what the damage is over time, but this is going to go on well into 2021 in all likelihood. How do you anticipate these numbers are going to impact the need in Middle Tennessee and these other 45 counties that you represent?
Thank you for asking that. So what we've seen so far just in Middle Tennessee, the service area that we support, we've seen about a 50% increase. So if you just look at the raw numbers, we were already at 350,000 people that are food insecure with a very low unemployment rate, and now what are we around 14% or so. Our numbers with 50% increase we've seen, so that's about 175,000 additional people that are food insecure. On a national basis from Feeding America, they're reporting that there could be another 17 million people on top of the already 40 million people in the US that are food insecure. And, we've been doing a lot of work to go back from the last recession, and it took 10 years to recover to pre-recession food insecure numbers. So when you think about a pandemic, which we haven't experienced before, I feel like this is going to go on for some time. I don't have a crystal ball, but I do know that this is not months, this is years that it's going to take for us to recover from this. It's much easier to slip backwards than it is to move people forward, and it's going to take this entire community to lift these neighbors of ours up. So we can get back to a vibrant national economy.
I think that is the interesting thing with the pandemic, that it does take a lot of collaboration. It does take a whole community, as you said. It's not just food, as you said. It's people working together. And one of the really fascinating things to me is the resilience of the American people of Tennessee, people in every state, in forming partnerships and coming together in ways they may not have, unexpected ways, highly innovative ways, creative ways. Describe some of the partnerships that you have engaged with in addressing this once in a lifetime assault that we have with this pandemic.
Yeah, I will tell you the partnerships have been, if you look at the shining spot of something this negative, has been amazing. I'll give you a couple examples. Every time there's a disaster, we work with OEM and we prepare food for our homeless communities. And that disaster could be the weather gets too cold, we have an ice storm, tornadoes, whatever it is. We are always there to serve our homeless community. And with the pandemic, there's about 300 individuals out at the fairgrounds, and we were serving them, and we got a call from HCA, and they're partners with Seduxo, and they were still paying their staff, but they didn't have the workers on site that they needed to feed. So they said, is there something they could do with us? So our partnership is we provide the chefs at Seduxo the food, they create the menus, and the food goes out to the fairgrounds, and they do 2 meals a day, 5 days a week. And on the weekends, Second Harvest, we still prepare the food over the weekend. There are some other partners that have also stepped up to deliver food to the fairgrounds as well. But by having that partnership and allowing their people to do great work, I've heard nothing from them except for how grateful they are to have that opportunity to serve and to be a part of helping other people while doing their jobs and getting paid to do it. So that has just been wonderful. And we're going to continue doing that at least through June. And then we'll continue to have discussions with what it looks like with HCA staff starting to come back. So that's just one. Another one would be with restaurants here in Nashville. Chef Sean Brock and other chefs, we've been working with them. And again, we provide them the food. The chefs create menus. So we take meals. We're doing about 3,000 meals a week, and those go to our partner agencies. And clients can come get a wonderfully prepared meal from some of the great chefs here in Nashville. The cool thing about this partnership, too, is it gave the restaurants an opportunity to bring back some of their staff. The Convention and Visitors Corp through Butch Spearden gave us Visa gift cards that are going to the restaurant staff. So there's a win-win for everybody. We're feeding the people in need. The restaurants get to stay involved, and they're stepping up to give back to the community, and they're getting to take some additional funds home for themselves. The list goes on. We've never done this before. We are doing home delivery. Right now we're doing over 1,000 home deliveries a week because, as you know, people have to isolate or they're restricted to their home because of COVID. And Amazon has been partnering with us to deliver those foods to the individual homes. Lyft is also partnering with us to do that. And then how it all started was through Vanderbilt medical students called us and said they wanted to help. So they do smaller deliveries for us. So we've got 3 sources of partners that are helping us get food to people directly to their homes that again, people can't get out and they need food, and we need to make sure that they have food.
That's fantastic. It really is amazing. The partnerships, the coming together, it really does demonstrate the resilience. And as we both discussed, it's going to take a lot of those sort of partnerships over a long period of time. Another interesting thing that separates this from other natural catastrophes is the fact that all schools closed.
Hmm.
And the schools, K through 12 schools, colleges, universities, medical schools closed. But reflect a little bit, because it is so unusual, on how the school closures impacted what you have done and the challenges that we have for the community in terms of food and food security.
Yeah, our children are critical. So we have always had a really good partnership with MNPS. And immediately we're on the phone with them and starting to figure out, like, what does this look like and how can we serve our children. And so we work with them. We do distribution at a number of different locations every week. So when the families come, it typically would be they would get breakfast and lunch for the children. But they didn't have any food for the families. And right now it's the collective family that is really important. So not only do they provide the breakfast and lunch, then they also get food boxes from Second Harvest. So when family comes to one of the drive-through locations, they get to get food to take home. We're also, with that same premise, we're working with Metro Parks at a variety of different community centers. So what we did is we looked at the areas throughout Nashville and made sure that we got coverage. We didn't want to leave any neighborhoods out, and we continue to make sure that we're reaching out and seeing if there's any other location that we need to make sure that we get food to. In some of our outlying counties, we've been doing a number of different things, mostly mobile pantries, but with some of the school children, we are launching, starting this next week, we've got 27 what we're calling summer school pantries that we will be opening up, serving over 7,000 children in a number of our outlying counties, which I think is going to be make a tremendous impact. And we will also have some summer feeding food sites that we get federal funding for that will be unsupplemental to those sites that we're going to be adding.
You know, might surprise some of our listeners that you are, or some of your team are first responders. Tell us a little bit about that.
When you look at first responders, anytime there's an emergency, we are considered, Second Harvest is considered first responders. So that really would be the organization as a whole. But for us, when we look at, who are our most essential workers, those are our warehouse workers, our drivers, and our volunteer engagement team, because that work has to happen regardless. The rest of the office staff, they're doing great work, but we sent them home to do that great work at home. And we've actually had to bring on 9 additional warehouse workers and drivers just to help us with the increase of pounds of food that are coming in and going out our doors.
You know, shifting a little bit to the federal government response, and all of us have seen the federal government step up in so many ways in terms of employment and stimulus and compensation for short periods of time. In terms of food, the USDA Coronavirus Food Assistance Program brings approximately $19 billion in direct support to agricultural producers. And this is part of the food box distribution program. How does this filter down to our community? People hear about $19 billion, and does the money come down? And if so, what kind of impact does it have on the community at the ground level?
Very timely question. So when you look at what really rolls down to the food banks and other food related organizations, is about $3 billion, still a huge number. And the way it is working is there's a variety of food boxes that are available. There's a produce box, there's a mixed box, there's some with some deli meats, and then there's also fresh milk that comes with that. So what we got our first shipment last week. I think we got 7 truckloads, or they're coming in over last week and this week. So it is first line food that is excellent food for us. It's just different on how we are working with the different distributors on getting the food. So it's a new process for us, but everything right now is new for us. But it is excellent food that is coming to the food banks, and that's food that'll be going out to our neighbors here in Tennessee. And that will continue through December. So we are taking absolutely as much food as that we can get in here and get out to our 460 partner agencies.
How can we leverage the food and nutrition resources that are coming online to communicate this whole value of food as medicine? Food really is a medicine, and it builds up everything from our immune system to the energy we have over the course of the day. So beyond the crisis itself, how can we leverage all of these resources that are coming online?
The conversation we have and why we think our relationships with the healthcare partners is so important is food is medicine, and people can't live healthy, productive lives if they don't have food. So there's this, all this information that we look at is, it's such a deterrent. If you don't have food, you're having to make really bad decisions like, what are you going to eat? Can I take my medicine? Can I afford health insurance? Can I afford to have a home? All these decisions come into play. So what we want to do is try to find ways to eliminate that, people having to make those decisions. And so if there's access to food, at least you can take that very basic need that is so critical to someone's health and livelihood off the table. For us, what we're excited about is some of the recent changes with some of the increase in the SNAP benefits, the pandemic EBT cards that are being made available, all this additional food through the additional food boxes that are coming to us. There's been other things that have changed that have been very beneficial with limiting some of the restrictions that have been on some of the programs that we have. Because right now it is all about making sure that food is available, so we don't go in the wrong direction on adding more people over time that are food insecure and have additional health issues.
I know we are a long way away of even being out of the woods, and with people coming back and getting outside and not sheltering down as much. Are there any shifting either priorities or needs you see coming as people open up and become more comfortable with getting back out and around in their communities?
I think the changes we've made in our distribution model about where we used to have, if you needed food, there was an engagement part. You could come and you could pick your food up. You got to choose, and it was in an environment. Now everything we're doing are mobile drive-throughs, so people aren't getting out of their cars. They get to remain safe, wearing masks or not wearing masks. They're in their car, and they just pop their trunk, and we get to put food in their trunk so they can get home to them. I think that type of distribution is going to stay with us for some time until we get out of this health crisis that we're currently in. So for us, just making sure that our models are safe and that we're doing everything we can to protect the individuals we're serving is going to be critical.
In my field of healthcare, there's going to be a huge transformation in the use of telemedicine and telehealth, and the comfort level that people have using technology to be able to access health and healthcare. It's trusted much more. The technology is better, and it's an acceleration probably 3 to 5 years in terms of the use. And that's a silver lining in some ways, and hard to talk about silver linings. And we have this tragedy of the pandemic and the disproportionate impact this is having on vulnerable populations. But are there any sort of corresponding or parallel silver linings or learnings that not just in the short term, but in the long term will be applied when it comes to food security, nutrition, maybe even agriculture?
One of the first things we talked about is something that I think we need to make sure that we're leveraging holistically moving forward is that collective partnerships that are going to be needed in the community. Housing and food. I mean, there are parallels there, health and food. I mean, that all comes together, and if we can lift all of that up, it's going to make a significant impact in our community. For us, I'll be honest with you, I know this is so basic, but just some of the new cleaning procedures and making sure that we're just, doing everything we can to protect our clients. We spend a lot of time, we have in the past, talking about what we call the last mile. And that is those people that are food insecure that may not have transportation, or how do we get food to those seniors that may be, isolated somewhere. And with trying to figure out these partnerships with Lyft and with Amazon, and we started working on these even before the pandemic, but how can we leverage these in the long term to try to, again, eliminate those types of decisions that or barriers that people are faced with when they need food. So I think there's a lot of things we have learned from this. I think the most important thing for me is be nimble and be willing to listen to where the need is and what the need is, and be open to things you probably would never have even thought of considering in the past.
Nancy, people listening to us are probably saying, well, how can I pitch in? And one of the other things that this pandemic brings out is the compassion and the caring of people across Tennessee, but across the country generally. We all are taking time and looking at our own lives and had more time to sort of focus on that since we've been in our homes, our home environments. In terms of people who are listening to us now, how do they contribute in some way to your efforts at Second Harvest?
We'll always start with financial support. When you think about Second Harvest, one of the things that I'm most proud of is as efficient as we can be. So every dollar that someone provides us can provide 4 meals, and 96 cents of every dollar that we raise goes to our food programs. So that is real important, and the need for funding is important. We have seen a decline in our grocery rescue donation foods that we get. So we're spending, since just the middle of March, we're spending over 80% more on purchased food just to be able to have that food in the supply line to get food out to folks. So there's increased costs across the board for us. But the other thing is really for people to understand that we still do need volunteers. We are doing them in small groups of 10 people, and that will continue to grow as the mayor and governor open things up. And we are always looking for food donations. But I think the last thing I would like to say, and what conversations like this really are beneficial to us, is highlighting how important food insecurity is, and that every single county, no matter where you live, there are neighbors, there are people that you may not know that are food insecure, and you can make a difference in their lives. So having this conversation and shedding the light on hunger and the conversation and making people know how important it is, especially to the health of this community, is critical.
And I think that is one of the silver linings, and there is no real silver lining, but the basic importance of nutrition, of food, number one. And I talk about it a lot as being medicine, and write prescriptions for food is that basic. I think the aspect of our immune system and the support of having just basic nutrition when you have a virus that knows no borders and we have no immunity to at all, the thing that we all can do is strengthen our own immune system. And then our third is that there's a basic need out there even before the pandemic that you're on the front line of. And it's going to make all of us pay a little bit more attention into that, to defining how big the issue is and how we can help out. So Nancy, thank you very much for being with us. Your message is a very, very strong one, and look forward to having you back on.
Thank you, Senator.
Thank you.